All right, let's get started. Oh, you're so sweet. I'm lifting the spinuses.
Yeah, she's helping you.
I see. So I'm gonna do a little bit here. Okay. There you go. Is that okay? So I have Wrigley here today. Wrigley is 4 years old. Wrigley's had a bad 3 months. Wrigley really started going downhill, went to all sorts of different experts and specialists to figure out what was going on. But basically, and I've said this in a lot of my videos, that people ask me, how do you know if a dog or a cat or a horse or a pig or a chicken needs to be adjusted? And first of all, the owners usually know, because they'll either identify pain. So let's say you're touching a dog or a cat and it winces, or you have a horse and you put the saddle on its back and it can't take the saddle, or you're riding a horse, you pull to turn to the right or bend the horse to the right to turn and the horse lurches back, it doesn't want to turn to the right. Those are clues. Another thing is socialization. So Wrigley has lost some socialization where Wrigley doesn't want to do the things and hang out with the people they normally hang out with. Wrigley used to like to jump in the pool when the parents were in the pool. Wrigley wouldn't do that anymore. So we see socialization changes and also pain points. So with Wrigley, they definitely identified coming down the back, right around the lower back or thoracolumbar junction, which is very common space to have a possible slip disc, wincing, pain, screaming out. Wrigley's seen every specialist and doing great work with the medical team, but the vets specifically said there could be a problem with one of the spinal discs. So that's why they brought the dog to me today. I'm not doing blood work. That's not my specialty, but I can check the spine and do a great job. Let's get started. Is it okay if we start with you? What do you think about that? Oh, what a cute face, right? She's so cute. She's so beautiful. All right, let's get started. Oh, you're so sweet. Okay, so I'm going to start with the atlas. I'm going to start to check the upper cervicals. And a big part of my training when I was working with the veterinarian chiropractors that were my mentors, they said never forget the atlas. So even if there's something obviously lower on the back, you still want to check the atlas. And so I'm going to bring you're so funny, you have to hold on to me, right? Bring your head up. And that's really good. That's a good extension, head down into flexion. Let's bring your head. And this is a fairly young dog, 4 years old, but the nose should be able to come to both shoulders. And if not, there's something restricting range of motion. It's pretty tight. So I'm going to palpate down the left side, and I'm already finding something at C5 on the left, and I'm going to laterally flex and adjust that. So we're going to come in here. Oh, there you go. You heard that, right?
Good job. Good adjustment.
Good. And there's still a little spots here. So I'm going to massage this out for a second, and I might even use a little percussive instrument. Here. Do you hear that noise? May I do it to your shoulder?
Oh, that feels good.
Yeah,
You're so lucky.
It's light. And I do want to go posterior on the posterior arch.
Good job, sweetie.
Posterior arch of atlas.
Okay.
I'm sorry. Okay, good. So now let's recheck. Can we recheck left lateral flexion? You remember that? We just tried that before. All right, so we're going to swing your head this way.
Oh, wow.
And it comes all the way over.
Good job, boo-boo.
Good. So we got it.
You're good.
Okay,
girl.
so I know that's not the main reason Wrigley's here, but I do want to check the body. And sometimes tension on the upper cervicals will create tension down the whole spine. And so there's 7 bones in the neck and then 13 in the thoracics. Humans have 12. Dogs and cats have 13. Horses have 18. But I have to count through each one. So here's the 7th. And now the first thoracic. The thoracics, you can feel the shoulder blades up here. Shoulder blades on quadrupeds are more on the side of the body, while on humans they lay flat on the back. T3 through T8 is the withers area, so I'm coming down through the withers. And we also say withers on dogs. So we talk about withers on horses, but dogs have withers. It's a correct terminology for dogs. And so I'm all the way down past the shoulder blade now, and I'm T8, T9, T10. Now we get tender. So that's kind of where it starts getting achy on you, right? T10.
Oh, boo-boo.
So the true transitional segment is T13, L1, but we're already getting tension because it's been 3 months now that you've been off your, what do you call it? You don't have we need to get your mojo back. Here's 7, 8, 9, 10. So let me come in here. May I get this for you?
Yep.
Wrigley? Okay.
Is that her shaking?
Yeah, because this is painful here.
Good girl.
But she kind of knows what I'm up to.
Good girl.
Mama's right here. We're gonna get you all better.
Okay.
We're gonna get you all better. Mama's right
I'm going to come up.
Yeah, Mama's right here, boo boo.
I'm lifting the spinuses.
Yeah, she's helping you.
There we go. Now I'm down. The dogs have 7 lumbars. Humans have 5. Horses have 6. And this is L7, L6, and L3. Now I'm going to be at the sacral apex where it meets the first coccygeal segment. I'm at the tail. And it's funny how she's just let me do this, right?
She's such a good girl.
Okay. And there we
What do
go.
you feel?
It's tight in here. So this section of the tail is tight. So I'm trying to traction out a little bit. Oh, it cracked.
Oh, good girl.
That was
Mommy
huge.
loves when I get that
All right.
done.
Yeah, that's a good one. Oh, good. All right. Your hips feel good. So you have good hips. Some dogs will get early onset hip dysplasia, but I'm not feeling that with her. Let me see. So I'm going to do a little bit here.
Okay.
There you go. Is that okay?
Good girl.
I want to do a little bit more of a stronger adjustment into the
Okay.
bad segment, and I found a few now. So I found one at T10, T13, and also L7, but I need to change the angle for that.
Sure.
So I actually want her to be up on all fours this time,
Wrigley up.
and
Good girl.
we're just trying to get that key spot. So I watch their breathing, I watch her nostril flare, I watch her eyes, if she lets me see them. Horses, we watch the ear set much more than dogs. We won't see much the change. The ears aren't as much of an antenna like a horse's is. But you also know the horse is a prey animal and a dog is a predator. So they're going to have a different body language, a prey animal versus a predator. But I have to take the clues that I can get body language from, and here it is. Okay, so that's the one.
Wait, you're okay. You're okay, sweetie. You're okay. Mama's
That's a
right
big one too. Okay. I'll put you right on my hips now. Ooh, that popped. Good.
Oh,
Hey, we're almost done.
it's okay. It's okay, boo boo.
We're almost done. We got
Here.
a second left.
Right.
And I got them really good.
Mommy's right here. You're okay.
And then we're gonna let it go down and shake out in a second, okay?
You think it's with this?
Yeah, it was.
Oh,
Okay, so let's
let her down?
let her down and let her shake. Hi, babe. Okay. You can see she's not scared of me.
Hi, boo boo. Hi. Yeah, she did so well. Oh, she started biting her tail. Just every
Yeah.
sign of anxiety and pain and
So
depression.
let's see how she does. We're
Okay.
gonna see a lot in the next 24 hours.
Okay.
And I think she will need a couple of treatments because she's been messed up for a couple of months now. So if it just happened 2 days ago,
Right.
that's a pretty fresh thing. And think about it for you as a human. If you like wrenched your back 2 days ago, it's a lot different than if it's been bad for 3 months. So I do ask you to go home and observe her for 2 days. And then if you want, bring her back next week and
Bring her
we'll
back
do a
next
follow-up,
week.
okay? Okay, so look who's back. We have Wayne, one of the 2 owners, and this is probably like 5 to 7 days later,
Yeah,
right?
exactly a week.
Tell us what you noticed this week.
Well, the 3 things that were greatly diminished was her personality, her ability to jump on the bed, and in general, just to move freely around with her happy face. And all of those have come back 100% since seeing Dr. Willen's.
Perfect. And you've been able to titrate down the dosage of the medicine as well, so that's being reduced.
Exactly.
Yeah. And the main thing is you're feeling good again, right?
Yeah, she's jumping on the bed, she's swimming, she's chasing squirrels,
And all our happy things.
and all of her happy things, and you can see how happy she is. And let's face it, if you weren't your own dog whisperer, she wouldn't be so affectionate and happy to see you.
Oh, thank
So
you.
she only met you once.
Yeah.
I mean, I'm a little jealous.
All right. This is awesome. Thank you so much. And I'm going to first just check some range of motion. Great extension. Then we're going to go to the right and check right lateral flexion. Perfect, actually. Left lateral flexion.
It was the one that
A little tighter.
Yeah.
And I can't get 100% on that one yet because it's still a little stiff. So we still want to adjust that area here. And it's the same spot as last time, it's C5. So I'm going to just laterally flex a little bit. Ooh, that just clicked. All right, perfect. Now let's see if it changes. Wow, all the way to the end. That was awesome. All right, good. So let's come down. Let me just check your atlas. Here, let's step back just a little bit. Okay, did that. Perfect. And here's the withers area. It gets a little tender down here, so we're
Yeah.
going to adjust this spot
And
too.
she actually has like little muscle twitches that when you
Yeah,
get
it
to
got,
that
it
area.
got a little
exactly
right there. There's the twitch.
Yeah, she had the jump sign I read about.
Yeah, so that's twitching a little.
Yeah.
Right there. Okay. So I'm going to actually put my knee under here to give it
Okay.
stabilization.
Got it? Great. Good.
Okay. Your leg into Arabesque.
Oh yeah, when she was walking, I thought her her right leg didn't have the same cadence as the left.
Oh,
when we
so
were in
we're
the
gonna
park
check that.
yesterday. But I could just be imagining.
No, it's probably, you probably have a good eye for it. You get to watch her all the time. So, got that. Okay. There's a little bit out on the back right hip, so I'm going to use the tapping instrument for that. It feels like this.
Yep. Cool.
It's not painful.
I got her.
And this should help because the hip was, it wasn't, it was just catching a little bit.
Yeah, when she had her leg like in extension, it didn't seem to go as far when she was running around the park. So we'll see how that goes. Yeah, that's the exact area they too thought was congested or irritated. But the x-ray showed no...
Ooh, it popped.
All right.
I got that one.
Good.
All right, let's see. Don't touch her for a minute. Let's just see
Yeah.
if she'll shake out.
Sure. Oh, boo-boo daddy. Looking to say, what's next?
Let's give her a second. There's the shake.
There's the
All right,
shake.
good.
There's the
How you
shake.
doing? Did you do good?
There's the shake, you good dog. Start with saying, part of practice, who is very well known, at least uptown.